All right, good morning Queensland, and good morning to all of our Facebook Live followers. Wonderful to see everyone here today. So we have some really good news today. So we only have 3 new cases, and they are all linked to the Indooroopilly cluster. They haven't been out in the community infectious, and they're all in home quarantine. So that's wonderful, wonderful news. Well done to everyone, and to everybody who's in home quarantine. Thank you, thank you, thank you for everything that you are doing in keeping your family safe and the community safe. We've had 20,484 tests in the past 24 hours, and I've just received some updated figures that in Cairns we've had over 4,200 tests. So that's great news in Cairns as well. So excellent work, and I know that Cairns is going through that short, sharp lockdown at the moment. But it's very encouraging to see Cairns residents coming out and getting tested. And remember, if you've got any symptoms whatsoever in Cairns or Yarrabah, please go and get a test. These 3 days are absolutely critical. So we have 155 active cases. We've got 13,271 people in home quarantine across Queensland. So thank you everyone for doing the right thing there. And over 11,000 vaccines in the past 24 hours. Now, yesterday we announced that we were taking registrations for people aged 16 to 59 for our mass vaccination centre, and we've had 50,000 registrations already to date. So well done, but we want to have even more registrations, remembering that the Commonwealth is responsible for 70% of the vaccinations in Queensland, and we are responsible for 30%, but it's wonderful to see that massive take up of our registration. So that's excellent, excellent news. All right, so as we know, that short sharp lockdown is working incredibly well in the southeast of our state, and it's wonderful to see those low case numbers today. So we're very pleased with that, and like I said, we're not out of the woods yet in terms of, you know, we could see clusters or cases popping up from time to time until we get the majority of our state vaccinated. So if you're sitting out there at home and thinking, should I get the vaccine or not? Can I tell you the answer is yes, yes, yes. It is absolutely critical that you get vaccinated. The more people we can get vaccinated sooner, the better we will be with the way in which our community is running at the moment. Okay, so in relation to the border zone, can I just say too that New South Wales has declared those 4 shires, Byron, Lismore, Ballina, Richmond Valley, as being hotspots that's close to our border. So Queenslanders should not be travelling down there at all whatsoever, and vice versa. They're in a 7-day lockdown. So people from that area should not be travelling as well, unless you are an essential worker, and that's a pretty narrow definition. We do not want to see mass movement happening there at all. The Deputy Commissioner will update you shortly, but there will be an increased presence on our border to ensure that people are complying with the directions that have been given by the New South Wales Government and not crossing into Queensland, and vice versa. We don't want to see Queenslanders going down there. It's for 7 days, everyone, so let's all do the right thing. And finally, the Treasurer is here today. He's going to talk about the support package that CBRC approved yesterday to support our tourism and hospitality industry, but also with cleaning rebates as well. So it's around $70 million. And we want to make sure that we're providing that extra assistance to businesses out there that are doing it tough, and I'll get the Treasurer to address that. Okay, I'll hand over to Dr. Young first.
So 3 new cases in Queensland overnight, all of them locally acquired, all linked to the Indooroopilly cluster, and all in home quarantine. Now I'm going to go through them just so that people can understand that there is an ongoing risk, but as long as people maintain that home quarantine, we'll be fine. So one case is a student at Brisbane Boys Grammar School who tested positive on day 8 of their quarantine, so tested negative when they first went into quarantine and not infectious in the community therefore. The second is a student at Ironside who tested positive on day 7. Again, not infectious in the community, they tested negative when they went into quarantine. And the third is a household contact of 2 known cases from Brisbane Boys Grammar School who's tested positive on day 9 when they went into quarantine. So this is an adult. And again, they tested negative when they went into quarantine. So I know how tough this must be for all of those people in home quarantine, but it's really important that they maintain it for the full 14 days since they've been last exposed to an infectious person. That's critical. So as people develop infection who are in those households, that 14 days quarantine unfortunately starts all over again for those people. So this will be very, very difficult for those families going forward, but it's critical so that we can limit the spread of this virus. And congratulations to Cairns. That 4,206 tests that were done in the last 24 hours is fantastic. That's an absolutely brilliant response from Cairns. I'd also like to comment about the work that the Public Health Unit has done up there. So you might remember that that marine pilot developed symptoms on the 31st of July, which means his infectious period went back to the 29th of July, 2 days before. But he was fully vaccinated, and we know that can change whether or not someone gets any symptoms at all. So therefore, now we've got this information from New Zealand about the ship that he piloted. He came off that ship on the 23rd of July, and we think that's probably where he acquired it. We're going to have to go back and contact trace to the 23rd of July. Then that taxi driver took the pilot to the airport on the 26th of July, and we know through whole genome sequencing that those two are linked. But that was before we thought he was infectious, which is why he wasn't picked up on contact tracing. But we're now going back further. So people in Cairns, there will be venues put up there, and please just take note, because you might have been in one of those venues going back to that 23rd of July. That's really important. Now, in terms of the border zone, as you've heard from the Premier, New South Wales has declared 4 of the LGAs in the border zone that we have in place as hotspots, and they've put in place stay-at-home orders for those 4 LGAs. So it's really important that anyone in Queensland who's been in any of those 4 local government areas since the 31st of July, which is the date when that man drove up from Sydney to Byron Bay while infectious, that you now are bound by those same requirements that New South Wales has put in place. So anyone who has been in those 4 LGAs and they've gone anywhere else out of those 4 LGAs, whether in New South Wales or in Queensland or indeed anywhere else, now needs to stay at home except for those 4 reasons that we're all used to. So it's really important because he was infectious in the community from the 31st of July. Now, it's been confirmed that he never travelled into Queensland. He travelled from Sydney to Byron Bay on the 31st of July. He never travelled into Queensland. So that is good. That's reassuring. But having said that, anyone who's been in those 4 LGAs while he was there needs to now stay at home except for those essential reasons. Thank you.
Well, you know it's going to be a good day when the Chief Health Officer starts our daily briefing by saying she has excellent news, and that's what she did this morning. Just 3 new cases, continued reduction in the number of cases linked to the Indooroopilly Delta cluster, all linked and all in home quarantine for their entire infectious period, as well as 0 new cases in Cairns, despite more than 4,000 tests. As you've heard, the 3 positives tested positive on day 7, 8 and 9, underlining just how important that entire 14-day quarantine period is. We are aware of some shortage of product lines in supermarkets in and around Cairns. These are not caused by a shortage of products in the state, they are caused by panic buying. The supermarkets will deploy additional products to those stores, but again it's important just to underline to people in Cairns that they will not run out of goods. Please only buy what you need, please only shop alone if you can, not in groups, and please be kind to our essential workers. The positive case in those shires within the border zone, of course, is concerning. Anyone in Queensland who's been in those 4 local government areas will be subject to the same conditions. Police will strengthen border checks. We will have a thick blue line to protect us from cases coming north from New South Wales. QPS, the Queensland Police Service, has confirmed, and as you've heard from Dr Young, the case in Byron Bay did not travel from Queensland as some reported yesterday. They travelled north by car from Sydney after being in contact with a known positive COVID case.
Well done, Queensland. The message is clear. If you live in Queensland and you travel to those lockdown areas of New South Wales in the border zone, you must comply with the New South Wales directions. So you must be staying home and only leaving for those essential reasons. So check the New South Wales website of what those restrictions are. It is absolutely critical, just like everyone else who is associated with the Indooroopilly cluster are staying home and complying with home quarantine directions, and everyone in Cairns and Yarrabah are staying home with the lockdown. It is just as important anyone who lives in Queensland, on the Gold Coast particularly, who travel into those 4 lockdown areas since the 31st of July, comply with that lockdown direction. That way we can keep our community safe. Of course, coming out to get tested if you have any symptoms whatsoever. To Cairns and Yarrabah, fantastic work. Keep up that level of testing. Over 4,000 means 20% of all the tests we did in Queensland yesterday were taken in Cairns and in Yarrabah. So fantastic work. Thank you to all of our health workers and the private pathologists up there doing the testing. We are really pleased with the great work you're doing. And I want to put a shout out for our other health workers. I know I've got health workers from our Townsville HHS who travelled to Cairns to put themselves in a lockdown area so that they could help the Cairns and Hinterland Hospital and Health Service with whatever support they need. So thank you to those other health workers who have gone into that area to help support Cairns. We really appreciate it. I know it's a tough time, but if we do this together, you can get through this lockdown just as we have down here in southeast Queensland. Thank you to everyone who registered yesterday. Over 50,000 people registered for a vaccine. Keep up the great work, keep registering, and we will then be able to give you an opportunity to call forward and get a booking. But of course, GPs and pharmacies are also doing vaccinations. So take up those options, get vaccinated, especially if you're 60 and older, because it's about keeping you safe.
Good morning. Not surprisingly and pleasingly, since we've come out of lockdown in the southeast corner, we've seen our enforcement activity drop significantly. In the past 24 hours, we've seen no arrests and only 7 penalty infringement notices. As you've just heard, the compliance levels in Cairns are very high. So to the people of Cairns and Yarrabah, thank you very much for what you're doing up there. Let's please keep this going. We're seeing very low police interactions with people where action has to be taken up there. We only had 13 calls for service in the last 24 hours as well. The one area, as I keep saying, that we want to see improvement in is mask wearing. So 205 persons were issued with masks by police yesterday. So please, as I keep saying, make sure you carry and wear your mask when you need to. And we had to issue on-the-spot fines for 2 persons who refused to wear them. As you've heard, there will be some changes with our border operations, particularly in the Gold Coast, New South Wales border, but right along that border. Yesterday we intercepted 3,520 vehicles, so it is still a very high volume that's coming across the border there. We turned around 64 vehicles yesterday. For those people that live in those areas, you need to understand there'll be change to the border passes as a result of the decisions that have been made. The best place to find the information around this will be on the Queensland Health website, and as this information becomes available, that will be posted, and obviously the new passes will come into play. We will increase our operational capability in that area to make sure that we are intercepting higher numbers of, or higher percentage of people coming across. What should happen with these new restrictions is people should really reflect on whether they need to cross that border or not. So what we want to see is the numbers of vehicles drop significantly coming across the border, and only those that have the essential purposes and the proper exemptions coming across. Thank you.
Well, good morning everyone, including everyone watching live and online this morning. We know since the pandemic started that the virus keeps changing, that COVID keeps changing. And as a consequence, our response to COVID must keep changing as well. That's why today, on behalf of the government, I'm pleased to announce another $70 million in business support and business benefits that will flow to Queensland businesses and industry at this time. What we've been doing is working closely with business and industry leaders, including leaders of peak industry bodies and business bodies, and I want to thank them for the support they've provided to the government. That's deep and ongoing engagement we've had with those individuals and those stakeholder groups. I also want to thank the economic team in the government, the Deputy Premier, the Minister for Tourism, Sterling Hinchliffe, and the Minister for Small Business, Di Farmer, for the contribution they've made to this package as well. So this package has been tailored to best meet industry's needs. It includes a number of initiatives, payroll tax deferrals for tourism and hospitality businesses in particular. That's the focus of this package, tourism and hospitality businesses who are doing it tough if they declare they've been impacted by the lockdowns. We're waiving, refunding or deferring a range of fees and charges across government for eligible tourism and hospitality businesses across the state for 12 months, so for this financial year until the 30th of June 2022. There's a range of fees and charges we'll be refunding or waiving. We're waiving or refunding all liquor licensing fees for tourism and hospitality businesses for this financial year. That'll be a benefit of around $22 million alone for business and industry in the tourism and hospitality space. We're also extending our $5,000 business support grants to all large tourism and hospitality businesses across Queensland. And the government is also setting aside $20 million for a COVID cleaning rebate. The government will pay 80% of small and medium-sized businesses cleaning costs if they are a COVID exposed site, up to a maximum of $10,000. So we hope that will help businesses who may become COVID exposed sites. So this is about our government flexing in response to what COVID is doing to businesses and to our economy. We obviously want to help businesses get back on their feet as soon as possible, to rebound as soon as possible, and every Queenslander can play a role there when we come out of lockdown, to spend particularly in your local small and family businesses, to help them in your local community. I know they will appreciate it, and of course we will get the benefit across our state for Queenslanders backing in Queensland businesses. And we're going to do everything we can to keep our economy moving forward and support those businesses across Queensland.
Thanks. Any questions about the details today?
When you talk about branching out the border at the border, is there anything kind of left in the deck of cards that you can pull out other than urging people not to cross the border?
Sorry, in relation...
Is there anything further you can do to restrict travel at the border?
Well, the police at the moment are going to increase their enforcement down there, as you heard the Deputy Commissioner say, but it's a 7-day lockdown for those regions, and we would hope that those regions are abiding by that. And as of yet, we haven't heard of any further community transmissions in there, except for that gentleman who has visited that area. So we'll be keeping a really, really close eye on what happens there over the coming days during that 7-day lockdown period for those particular shires in New South Wales.
Is there a call to prioritise Year 12 students because it's such an important year of school? Is there any consideration of that at all?
In those particular zones?
For Year 12 students?
It's 7 days. They can do remote learning.
Sorry, just across Queensland, there's a call to prioritise vaccination for Year 12 students because it's such an important year of school. Is the government considering that at all?
Well, if they're over 16, they can register, but our priority at the moment is in relation to the distribution of the vaccine. And of course, once we get more supply on board, we can broaden the number of people that are getting it. So at the moment, we have to work with what we've got. So we will make sure that we are targeting that age group with the Pfizer, but of course, the older age groups can go and see their GPs.
Has this business support package come too little too late, given we've just had our fourth lockdown?
Not at all. We've been progressively announcing, millions of dollars to businesses right across this state. Our COVID economic recovery plan was over $11 billion. This is basically to help those businesses that have struggled over these most recent lockdowns. And like we've said, National Cabinet now has a very clear plan that once we get to that 70 and 80% of vaccinations, we'll be able to see more movement across our businesses.
Premier, you've repeatedly told us throughout the pandemic that all your decisions relating to COVID has been based solely on health advice.
Yes.
We've now got documents that have been authored by your department and finally released under RTI that shows that you're receiving monthly polling and focus group research, and that the initial documents show that this research was set up to help guide your decision making.
No, not my decision making. The research was done to help with the advertising campaigns that the COVID task force put in place. And I think everyone knows very clearly how much I was personally attacked and the government was personally attacked for some of the strong stances that we took, taking on advice, Dr. Young's clear advice about the health. And there's been High Court cases that have backed in our decision making, and it's interesting to see that when we were one of the first ones to come out and do these hard and fast lockdowns, it's now become the mantra of nearly every other state and territory, including the federal government.
You call it tax, others would call it scrutiny, but according to the document that your department has authored, it's not about messaging, it's not about advertising exclusively. It says, and I quote, this research will help guide the decision making and communications approach around the lifting of restrictions. The decision making.
Well, that's not correct.
Well, it says
but I reject that.
Right. So it also says that there are 17 waves of research that are coming in, and that again it shows that it's about guiding your decision making.
No, well, that's not correct, Michael. And I think what you'll find there is nearly every state, including the federal government, from time to time does sentiment testing and research, especially to guide their advertising campaigns. The advertising campaigns have to be based on value for money and making sure there is clear messaging to the public, whether that's to do with COVID and social distancing and staying at home. These are important messaging that needs to happen. And of course, and not all of it, no, I haven't.
Your government paid more than $528,000.
As I said,
and you've extended those contracts. So it's ongoing contracts.
No need to get a little bit grumpy there, but very, very, very clearly, as I said, the COVID task force asked for some of that research, and it helped guide their messaging for advertising campaigns.
Okay,
and I think you'll find that the federal government did exactly the same thing, and I'm quite sure nearly every other state did exactly the same thing.
Here's a question that's being authored by your department, saying they want the community's views about COVID-19 restrictions, including the lifting of restrictions on a region-by-region or sector-by-sector versus all of Queensland basis. That's asking people responding to these surveys and focus groups what their views are on the lifting of restrictions on region-by-region, sector-by-sector versus all of the Queensland basis.
I think that's...
This is not advertising, Premier.
Well, it's based on helping with the advertising, and I think that's great. They are asking those things, Michael, because businesses have been really badly impacted by COVID, and that's exactly why my government put in place this comprehensive COVID economic recovery response.
It asks whether what should be a trigger for lifting restrictions.
Well, it can ask that. That's not going to guide my decision making. That's not going to guide my decision making. I'll tell you who helps guide my decision making. This wonderful woman standing to the left of me, who has helped keep Queenslanders safe.
Lifetime misery
every state and territory, including the federal government, would have invested money into some sentiment testing and into some research. I mean, it would be absolutely negligent not to do that.
Putting aside the other government.
All right, I think we might go to some other questions.
Do you commit to publicly releasing?
No, it's not.
Why hasn't Les Walker resigned from the Transport?
Thank you. That's a really good question. So, look, Les has indicated to me, so he's written that letter to me, and I'll forward that to the clerk. And at the next sitting of Parliament is when it takes effect. The Parliament has to give effect, is my understanding.
Is that really a just punishment for someone who did?
I think so. Yes. Yeah.
Why won't you release the research?
Like I said, Michael, every state and territory in the federal government has done basically exactly the same sentiment testing. All right. Okay.
A
Couple more
You're
questions.
Saying that it's not being done, that it's not guiding your decision making. It's all about advertising.
It hasn't guided my decision making. I have guided my decision. I'm responsible for the decisions in this state, and what has kept Queenslanders safe is the advice that our Chief Health Officer has provided to me. Just have a look what we've done what Queenslanders have done, honestly, in the past 8 days, going into a short, sharp lockdown, and those figures are coming down. And we now have the majority of people in home quarantine. That's the result of Queenslanders doing the right thing and listening to the health advice.
Why is your argument is that you're basing your advice exclusively on health advice? Why is your department asking for focus group information to help guide your
Michael, I don't need a focus group. I go and talk to Queenslanders. I think you know me, you've known me for many years. I'm out there talking to Queenslanders nearly every single day, and they can tell me what they're thinking and what they're feeling. And, there's no greater people to listen to than the great people of this state.
Do you know that this polling also asks people to rate the performance of individuals in the police department, the health, and
No, I
the
didn't.
government?
No.
Have you seen it?
No, I haven't seen that.
Right. It actually asks these questions.
Well, look, I'm quite sure there's a whole lot of sentiment testing and research, market research that's being done in a lot of departments right across Queensland, okay? I don't see everything, Michael, okay? I'm dealing with a global pandemic here. I'm dealing with saving people's lives. I'm dealing with an economic recovery plan because our businesses are hurting. That's what I'm focused on.
Your department has spent more than $500,000 on this research, and you're saying you haven't seen it, or you're not really looking at it?
I've seen some of it, but most of it happens after the event.
Okay, so if you've seen it, and
I've seen some of it. I said I've seen some of it.
People who, during the border closures, during other restrictions, who had to lay people off, you've said that it was about health advice, and you're looking at the popularity of your decisions.
No, because Michael, you know very clearly, everyone was yelling at me to open the borders. So don't talk to me about popularity. Everyone was attacking me when I stood my ground here and backed in the Chief Health Officer's advice to me when, it was seen as not being popular out there in the public, and it kept Queenslanders safe.
Which parts of the research have you seen?
Sorry?
Which parts?
I'm not going to go in and out of that today, for goodness sake. Yeah, I've seen some of it. I don't see all of it. I've seen some of it.
Which parts?
No, I'm not going into that today. That's ridiculous.
Premier, just on Les Walker,
Yes.
he continues to be paid his committee salary while he's not actually sitting on the committee?
It has to be the Parliament's meeting at the end of this month, so the Parliament will actually put that into effect from that date.
Does it get backdated to when you bring
You'd have to ask the clerk that.
Premier, the Treasury's raised some questions about whether putting the Olympic venue on the glass site at the West End will cost jobs there, even though it's your own plan backed by your government. Is there a split in the government on that?
No, there's definitely not. And look, because we're dealing with the health issues at the moment, the Lord Mayor and I will be joining each other later on this week to talk more about the Olympics and what it means for the state. But just in terms of that, there is a site that's been identified. We think it's a good site. We will work with that company. But of course, this is 11 years away, so we've got time to work through that. So all of the cabinet will be involved, the council will be involved, and we'll get the right outcome, definitely. Yep.
Now, the teething problems with the vaccination hub at Southland, we've heard that some people have registered, but they can't look at that particular site yet. Are they going to have to wait a couple of months to actually get that site, or what's
It doesn't open till Wednesday, so we need people to register, and then we'll ask them to book according to the priority.
Practically, when do you think people who are 16, 20, 30, who are registering, when do you think they actually will be offered the chance to book appointments?
Well, please could you ask the Commonwealth, because it depends when we get those additional doses. So the Commonwealth has been excellent in bringing forward some doses from September, but that means we'll have fewer doses in September. So it really is just balancing how much vaccine we've got. Our intent is every dose of vaccine goes into someone's arm as quickly as we can get it from the Commonwealth.
You've got a vague idea of how many doses you're going to get, so when do you actually...
Yeah, I've got a vague idea, but because it's vague, I need to have the actual specifics going forward beyond September. But the Commonwealth has said publicly that they expect there will be more doses in September, which is excellent news. And as soon as we get those doses, we'll be offering people to book who've registered. So that's why I need every single person to get online and register, and then we'll be able to pull them and organise those bookings. I don't want there to be a single vacant booking slot. So yes, we had 50,000 yesterday, but Queensland is now getting about 100,000 doses a week of Pfizer coming to us, and a similar amount to GPs. So people have got to remember that you can go to your GP. Not all GPs yet, but that's rapidly escalating. So it's really important that people who want AstraZeneca, if you're 60 years of age or older, you go immediately, get your first dose. If it's more than 8 weeks, get your second dose, as I am today. I'm getting my second dose of AstraZeneca today. If you're under 60, you can go and talk to your GP about getting AstraZeneca at any stage, or you can register for one of our hubs and we'll send you out a booking when it's your turn in that list, or you can check where you can go and see a GP to get Pfizer.
Any information about when we might get the data?
Yes, we have. So we had that discussion yesterday at AHPPC, so that'll start coming in September as well.
Are you aware of this market research that's been conducted? Are you aware of it? Have you ever heard it discussed? Has it ever been shown to you?
I haven't seen it. I knew it was happening because occasionally they've said, and I've done quite a few ads myself to discuss various issues, they've said I might like to focus on something that cuts through. I'm not a advertising or marketing person, so I really need that support from my media team within Queensland Health and also from the Premier's media team.
Separate to your preparation for advertising, have you been aware of it, and has it ever been discussed with you?
Only in terms of what are the ads. So we've been doing a lot of ads on regional radio, we've been doing ads on TV, and always they've said to me what they think will cut through. Because I might have a view, but I'm a doctor, and quite often the terminology, and I apologise to all of you, the terminology is not clear, what I'm saying is not clear. So I'm very, very grateful that people have done work to find out what cuts through. There's no point me having what I think should happen if I can't then share that very, very clearly with the general community.
Your opinion on the question of people being asked their opinions on when restrictions should be lifted?
I haven't been involved in what questions were asked or what the answers were.
Your opinion on the fact that people are being asked on when a trigger should lift the restrictions?
As I've said, I'm not a media type person. I didn't even do that in my MBA, so I'm not the right person to be involved in any of those decisions, but I'm very grateful to the information that came out of it that my team could share with me that helped guide some of that messaging that I've been giving.
Had a brain tube or Victoria Hospital that died in emergency like the Gold Coast Hospital. Was that based on COVID reasons?
Sorry, I can't hear you. Between that and masks.
A patient with a brain tube
Yep.
at Port Macquarie Hospital has been denied an emergency flight to Gold Coast Uni Hospital. Is that a COVID reason? Will that continue?
No. No, we accept anyone who needs emergency care in Queensland, whether they're from Papua New Guinea, from the Philippines, anyone. So if someone needs care, urgent care in Queensland, we accept them.
Treasurer, do you continue to hold some of those? Do you you continue to hold some of those
really are the
concerns?
last
You
one.
spoke pretty blatantly about a couple of weeks ago around the glass factory and whether that could cost jobs. You said you didn't want to see jobs going to Sydney.
Absolutely, we don't want that to happen. We don't want any jobs to leave Queensland. That glass has been made on that site for 100 years. There are 220 people who work there. Great prospects for use for the Olympics, but if we do anything, we've got to bring workers with us and the company, and I'm sure we can work through all of those issues.
So will you be pushing for that site to remain untouched, or what?
And we'll work through all issues relevant to the establishment of an international broadcast centre, but protecting jobs is our number one priority now. You know how much business and industry are struggling at the moment. We created more than 50% of jobs in Australia in 1 month alone in June. We created 2/3 of jobs in Australia since the pandemic started. We've got to protect every job, but we'll work through those issues, and thankfully we've got 11 years to get it right.
Do you or do you not back the current plan as it stands, having that site?
There's a concept plan. There's a concept plan for a range of Olympic-related facilities and infrastructure across Queensland, and we'll work through all of those issues before they land. But I do know in Paris they are still finalising some locations today. That's 3 years before the Olympics. So we've got plenty of time to work through this, but let's focus, as the Premier said, on our health response, on our economic recovery and protecting Queensland jobs.
There's like $70 million for communities between Bundaberg and Gold, which haven't been locked down but have been affected by COVID.
Sorry, what was the first part?
What is in the $70 million for communities between Bundaberg and Gold?
Well, all of those businesses, tourism businesses, in fact, every small business with payroll under $10 million, they're all eligible for the $5,000 grant. We've now expanded it to large tourism and hospitality businesses, so any large businesses as well. They were originally restricted to the 11 local government areas there. And then, of course, we're offsetting marina fees, so if you berth a vessel in a privately owned or operated marina from Harvey Bay north to Cooktown, you'll get a fee waiver. You'll also get waivers on those other state fees. For example, if you're in Harvey Bay and you run a whale watching business, your fees will be waived for the next 12 months. So there'll be a lot of benefits for regional companies and regional businesses. Okay, thank you.